My name is Howard Catton. I am a nurse and the Chief Executive Officer of the International Council of Nurses. 2020 is the International Year of the Nurse and the Midwife and was to be a celebration of the contribution of nurses to the health of the population. Sadly, this celebration is on hold as nurses around the world work tirelessly to combat the COVID-19 pandemic, risking and sometimes losing their lives. The pandemic has underscored that nurses are the backbone of health systems and are essential to protecting and improving health and well-being. This dedication must not be in vain. Efforts to support the nursing workforce must be increased. The first ever State of the World's Nursing Report published this year has provided the evidence, and ICN urges governments to implement the recommendations and invest in nursing education, jobs and leadership. The number of COVID-19 infections and deaths in health workers is a global emergency. ICN is collecting data on these numbers and estimates that 8% of all cases are among healthcare workers, and the WHO believes it could be up to 10%, which is over 2 million cases and rising. Unfortunately, many countries are not collecting data, which has immediate and serious negative implications. Data is crucial to allow for meaningful international analysis and understanding of infection rates. As such, ICN repeats the call to member states to immediately collect systematic and standardised data on healthcare worker infections and deaths, supported by clear reporting and monitoring mechanisms. With new cases steadily increasing every week over the last 2 months in the region, we must act now. Nurses and other healthcare workers must also be prioritised to receive a vaccine against COVID-19 once available. Governments have a duty to protect nurses from unnecessary risk to their health and safety while carrying out their work. This is both a human and worker right and will allow nurses to continue to meet the health needs of populations. Prioritising the vaccination of nurses will also protect patients and help to safeguard the healthcare systems that nurses work within, which are under immense pressure and strain across the region and the world. Strengthening the nursing workforce is essential to transforming health systems. The pandemic has highlighted the importance of strong primary health care systems and for health systems resilience. Nurses, sometimes the only healthcare professional in communities, increase healthcare access and are essential to developing and delivering PHC models. However, to fully leverage this requires nursing leadership in policy making at all levels. The State of the World's Nursing Report shows that 30 countries in the region have a government chief nursing officer. ICN calls on the remaining countries in the region to establish a chief nursing officer position with the appropriate support and resourcing and at a senior decision-making level. ICN fully supports the regional director's commitment to establish such a post for the region. The number of nurses in the European region is insufficient, and with demographic changes and attrition in the profession, current and projected future needs will not be met unless political commitment is made to support and invest in the nursing workforce. Thank you.